Effective Monday, November 23rd at 12:01 a.m., Toronto and Peel will be moved into lockdown.
Today, Ontario's Premier delivered the hard news.
It's clear more needs to be done to limit community transmission of COVID-19 so that we can keep our schools open, safeguard our health system capacity, and protect our most vulnerable.
That means no gathering with anyone outside your household for at least 28 days. Gyms, casinos, and salons are closed. Retail is back to delivery and pickup. Rule breakers will face a fine of $750. Toronto's mayor backs it all.
The people who are getting sick are employees, they are business owners, and they are the customers of those businesses. We simply cannot have a healthy economy without healthy people.
Peel Region is sounding the alarm as some of its hospitals are already full.
So they're being treated in the hallways in non-traditional spaces. A lot of these people are sick, severely sick, and they have COVID.
When the new restrictions go into effect, there will be 2 regions on lockdown and 5 in the red.
The lockdowns and the restrictions, they buy us time, but they're not a solution. The solution is having strong test, trace, isolate support systems, and it's having supports for people.
You mind just grabbing a squeak of hand sanitizer here?
This barbershop owner says after working hard to keep staff and clients safe, this cuts too deep.
Why not find the people that are violating it, shut them down for 28 days, and let the rest of the people who are doing things properly survive? Because it's going to be a bigger shutdown than just 28 days for a lot of these businesses, and it's scary.
The province said it will help struggling businesses with more funding. Health officials say support for workers like guaranteed sick days is needed too. Magda Gebrselassie, CBC News, Toronto.
So let's bring in the experts, infectious disease specialist Dr. Susie Hoda and Dr. Isaac Bogosh joining us from Toronto. And doctors, we have new restrictions in your city and a plea from the Prime Minister. And Dr. Bogosh, let's start with you. What needs to happen in the next week or two in the Toronto area for this to work?
Well, a few things. First, we need time. It's certainly going to take more than a week before we start to see cases perhaps respond to these measures. The next thing we need is adherence, and which is going to be very challenging because one of the measures is for people to really stay at home as much as possible and not mingle with others. And we've definitely had problems with spikes in cases because of private gatherings. And the third is support, especially support for people, communities and businesses that are disproportionately impacted by the virus and by policies to combat the virus.
And so, Dr. Hoda, you as a doctor see this all the time, practical solutions beyond these general principles. What would you add to what Dr. Bogosh says in terms of what needs to be done?
Well, I think part of it is really just supporting people in terms of dealing with all of these measures going on for so long, the fatigue that's setting in. And some of that can just be how we message things. So, really trying to keep a clear, calm, concise, and consistent messaging around what needs to happen. And trying to be positive about some of it too. Not just having always bad news stories, but trying to show some of the positive to keep people going.
Clear, calm, concise, and some good news and all of that. I like that message, and stand by, both of you. We'll come back to you a little bit later on in the newscast.